Hey everyone, how's it going? Today I'm working on a really interesting case of an ingrown toenail, and I'm excited to walk you through the entire process step by step with all the care this procedure demands. We'll also cover some awesome tips for keeping your feet healthy and of course have a little chat with you all because I love connecting with my amazing audience in the comments. So let's dive in. I'm here with a patient who has a ingrown toenail on their little toe, and this case is a bit tricky because they have a congenital bone deformity. This deformity causes the toe to sit at an angle, which makes the nail more likely to dig into the skin, especially on the back lateral side. As I'm examining it, I can see there's a granuloma, which is that inflamed tissue that forms when the nail presses into the skin. This is super common in cases like this, and the patient mentioned that the nail was trimmed before to try to fix it, but that actually made things worse. So what's going on here? The nail has something called onycholysis, which is a partial detachment caused by pressure from the neighboring toe. This created a perfect spot for irritation, and at first the patient thought it might be a fungal infection, but it's more about inflammation than anything else. To make things a bit more challenging, they're taking Roacutan, a strong medication for acne that makes the skin super thin, almost like a baby's skin. That means I have to be extra careful not to nick the skin during this procedure. Right now, I'm adjusting the foot to get a clear view of the nail. With a lot of care, I'm cleaning the area around the ingrown nail, removing any dead tissue or excess skin that's contributing to the inflammation. I can't cut the nail too short because that could make things worse, especially with the skin being so sensitive from the Roacutan. I'm using sterilized tools and working very precisely to reduce the granuloma and ease the pressure in the area. After cleaning and shaping the nail, I noticed it's quite curved, which is a problem because that shape keeps pressing into the skin. To fix this, I decided to use a fiber orthosis for this case. I can use a metal one because the patient's skin is too sensitive and any friction could cause more irritation. So I chose a super thin fiber 0.20 gauge, which will gently open up the nail over time, keeping it away from the skin without causing discomfort. Placing the orthosis carefully to make sure it doesn't touch the skin directly, avoiding any irritation. I also advise the patient to use an interdigital protector for the second toe, which is rubbing against the little toe and making things worse. This friction is a big factor in the problem, so the protector will help keep the toes separated, especially while they're still on Roacutan. Once the medication is done, their skin should go back to normal and the situation should improve even more. By the end of the procedure, the patient's skin was looking much calmer and the nail was nicely positioned with the orthosis. I did a final check to make sure everything was in place, and the results were great. The area is clean, no signs of acute inflammation, and the patient said they didn't feel any pain during the process. It's so rewarding to see this kind of progress. Doing this kind of procedure takes not just skill, but also a lot of empathy. I know an ingrown toenail can be incredibly uncomfortable, and being here with the patient, talking them through each step makes all the difference. During the session, I checked in to see if they were feeling okay, and they said everything was fine, which is such a relief. My goal is always to make sure the patient feels comfortable and safe, because taking care of your feet is about taking care of your overall well-being. And for all of you watching, let me say this. Please don't try to cut or fix an ingrown toenail at home. It can make things worse, like we saw in this case. Always seek out a trusted podologist, okay? So Where are you all watching from? Drop it in the comments below. I love hearing where my videos are reaching. Whether you're in Brazil, the US, Europe, or anywhere else in the world, let me know. And here's the deal. I read every single comment. Since there are so many, I reply little by little, but I absolutely love connecting with you all. So tell me what you thought of the video, if you've ever dealt with something like this, or if you have any questions about foot care. I'm always here to help. Here's an extra tip for those of you dealing with ingrown nails or similar issues. Keep your feet well moisturized, but not too damp, to avoid creating a breeding ground for fungi. Wearing comfortable shoes and avoiding rounding the edges of your nails when trimming can also prevent ingrown nails. These small habits can make a huge difference. If you enjoyed this video, please hit that like button, subscribe to the channel, and turn on the notification bell so you don't miss any of our daily videos. Every like, comment, and subscription tells YouTube that our content is valuable and high quality, which helps me keep bringing you tips and procedures like this one. So, share this video with anyone who needs some foot care advice or just loves learning about podology.